Welcome everyone. Today I'm going to discuss some of the important issues about impact investment fundamentals, model and frontiers, example of resources. Impact investment is social investment tools. Social investings, SRI, sustainable, responsible and impact investing. ESG, environmental, social and governance criteria. Impact investment, a philanthropic tools. In investing into companies, organizations, and funds with the intention to generate measurable social and environmental impact alongside a financial return. Any assets class or structures, cash, fixed income, equity, etc. Any expected financial return, interest rate, dividend, capital gain. Same fiduciary care as any institutional investment. Below market rate investments. Grants and recoverable grants, alternative and noble structure, fixed income, cash, guarantee cash, fixed income, public require alternative, program related investment, PRI, mission related investment. Mobilizing capital for the health community via impact investment, social thesis by investment thesis, social thesis building healthy and communities and a cultural of health, investment thesis repayments, revenue, saving, growth, liquidity, equals to impact investment. PRI defined for private foundation in tax code. Primary purpose accomplish one or more of the charitable, rigorous, society, literary, educational, and other exam purpose described in sections 170C to B of the code. No significant purpose. The production of income or the appreciations of property. No purpose. To lobby, support, or oppose candidate for public office or to accomplish any of the other political purpose forbidden to private fundamental by section of the code. Program related investment. Conventional market allocate capital to efficient profit maximization transaction. Typical absorb and repay large amount in standard structure over relatively short period of time. Investment opportunity in low income communities, communities of color, rural community and innovative sectors seldom fit the box. Typically small transactions lack standard features and require patience capitals to develop repayment capital without jeopardize investment financial strength. Given the scale of the capital needed to advance social equity in this area, PRI typically leverages the large dollar of commercial capital market. PRI typically finance the early risk stage of a project or a strategy or a supply credit enhancement to absorb the real or perceived risk for needed conventional investor in large transaction. Risk management or leverage, startup, proof of concept, expansion, sustainable growth. Risk management and leverage, capital structure, attack or leverage large sum of investment for change, senior trackles or layers, conventional capitals plus fundamental MRI. Credit enhancement, junior subordinate loans, often foundations PRI, finance loose transactions, often grants or public subsidies. Here, health is more than merely the absence of disease. It is physical, mental, and social well-being. Health People 2020 goals speaks to community development, attain high quality, long lives, achieve health equity, eliminate disparity, create social and physical environment that promote good health, provide quality of life, health in development, and health behavior across all of the states. Portfolio screening tracking measure. Populations, geography, sector network, value chains, access, innovation, ownership, governance. Metrics to drive capital to equity, health community. Social metrics inform investment strategy and track advance in equity, health, environment, sustainability, and wealth. Of affordable transit-oriented housing unit build or preserve. Valuables practice RARF. Squirrel feet of community clinic or other financial specs bills. Low income child cares and school slots added and or quality enhancement for the understand. Square miles of park space accessible to low income people, people with increased access to the healthy foods and quality food, job created low incomes residents and or residentials of color. Amount of small business and other loans to people of color and rural residents. US impact investment, a marketplace and culture of health via increasing sector public or private engagements. In 1960, communities and economic development. 1970, micro enterprise, enterprise conversation, education or chartered asset buildings, technology, clean tech, ed tech, social enterprise, health, food system, transit, orientation, development, art, cultures. Food Foundation, community developments, program related investment, community development, technical, financial institution, interfere centers of corporate responsibility, surveillance principle, art day, social investment forum, opportunity financial network, investor cycle, Chris Financial per coalitions for environmentally responsible economic or late 1983, impact investment association, mission investment exchange, global impact investment network, quantum philanthropy, city health ranking, green observatory, added overlay, health people, healthy place, culture of health, technology, anchor institution, value chain, lifelongs. There are different kind of investment demands in community foundation, private foundation, faith-based, health system, bank, pension or insurance company, other corporation and government. Investor demands it has in community foundations of General Birmingham, Health Group Foundations, Foundation for a Health Kentucky, Mary Rion Babcock Foundations, Ben Wood Foundations and Blue Moon Fund. There are coordinated strategy, multiple capital driving system change. Beside that, impact investment lifecycle has Google's landscape analysis, leverage donors, organization design, scope, government, risk and return objective, risk management for planning and policy level. For process and procedures level, managing or financial intermediate selection, staff consolidate roles, transaction monitorings and reporting. For program management, program execution, program integration, evaluations and learning commodities. So impact investment life cycle, invisible network and enterprise, investor, foundation and donor partner, government partner, market building and research partners. Place-based and value-based, payment memory trust, mission-related market rate investment strategy. So the ESI benefit beyond of the Pacific Northern, neither benefit nor direct harms, contrary to the missions. Place-based investor with the health life course overlay, the course health ranking model suggests investment opportunity that create social physical environment that promote good health for good. Potential impact investment provide financial for the organization and project that bid communities where the health choice in the easy choice. Community health center, quality childcare, micro enterprise, small business, anchors, transportations, banks, quality affordable housing, shelters, local reactions, green resort, transactions, access to fresh food and local park. And for social economics factors, we have childhood and youth development fund. Beside that, we have microfinance, small finance, community health, opportunity fund, open source, international and transition oriented development fund, affordable and supportive housing fund, asset fund of building, a health and food system fund. So, excellent impact via anchor institutions, suppliers, and neighboring business, art, cultures, renewable energy and greens, waste reduction, reduce complements, asset building, financial service, affordable and employer asset housing, transit-oriented development, healthcare, childcare, education, and social services. Frontier prevention versus intervention. At this intervention of the people, place, and times, we have Family Foundation with 184 millions of asset, working in 11 states of Southwest, 8 million allocations for PRIs. So Natural Capital Investment Fund provide feasible loans to small natural resources based on business. 12 years green from 100,000 Revolution Loans Fund and $15 million CDFI working across an state and create over 100,000 jobs and provide $60 million in financing. Operating grants to build organizational capacity, opportunity grant for the key strategy planning moment or project, capital grant to strategic balance sheets and provide permanent capital for leverage, PRI for expanding leverage capital strategy or organizational growth. Background MBF created to improve the health and wellness of the people's Money Black Foundation. We have different kind of things and loan for city communities, and beside that impact investment example, let's say investors, Robert Ole Johnson Foundation, social thesis, safe play, investment thesis, school district purchase service, asset and loan guarantee, building, and so on. Beside that, we have investors, TCSI, social thesis, reduce hospital, housing subsidies, loan, reduce cost, and community inventions. There are different kind of impact investment issues actually happening around the world. Now, in the COVID-19 situation, we need more investment, and if we get the proper investment and other things, by this way, we can grow our ecosystem in an effective way. So if you have any kind of question regarding this point, you can communicate with us. Thank you everyone for joining today's session.